Today, we're going to talk specifically about how bone health affects problems in your neck. And so, Dr. Anderson, talk with us a little bit about a condition called osteoporosis and how that affects the neck.
Osteoporosis is a bone fragility. That means the bone is much more likely to fracture. And this is a very common disease that we see throughout the world. And in spine surgery patients over the age of 50, about 30% of patients will have osteoporosis. The good news is that if it's diagnosed and properly assessed, there are effective treatment strategies. At the intersection of cervical spine disease and osteoporosis is really important to understand because the outcomes of surgery are much poorer in patients with untreated osteoporosis. Therefore, if you're over the age of 50 and are undergoing cervical spine surgery, it's really worth considering how is my bone doing and do I have osteoporosis.
We know that many patients who suffer with a neck condition do not actually need surgery to correct their condition. But for those patients who do need surgical intervention, it's very important to check that bone health because you're going to be putting metal, you're going to be putting screws and instruments and things into that bone. Talk to us about what happens if we don't check that bone health before surgery happens.
Yeah. When you look at the osteoporosis and results of cervical spine surgery, you will see that in large studies with many hundreds of patients, you'll see a decrease in good outcomes because the bone grafts that are placed in will fracture, they may not heal, or if metal or plastic cages are put in, then they wear their way into bone, a condition we call subsidence. Also, hardware may fail, and this leads to poor healing, what we call non-unions, revision surgery, and other bone-related complications. In addition, you have to worry about having other osteoporotic-related fractures regardless of your cervical spine condition, such as a hip or other spine fracture or wrist fracture. And we would also like to treat and prevent those if at all possible. And this is a good time, since you're undergoing a bone procedure, to at least consider having your bone assessed.
How do fractures that occur in your spine affect your neck?
Fractures can occur anywhere in the spine, and the most common types of fractures that people often hear about that result from low energy injuries, so these are just the fall from bed or fall from standing, are what are known as compression fractures. And there are other types of fractures that occur as well, but these are the most common fractures that present in the spine. And although compression fractures are not very common in the cervical spine, they are very common in the lumbar spine and the thoracic spine. What can happen with these compression fractures is that this can progressively result in a loss of alignment. And so this is where you'll commonly see older women or men who are very pitched forward. And that can be from several different causes, but one of the causes is from multiple compression fractures. Now, if a lot of those fractures do result in being pitched forward, that can sometimes, and especially if that's in the upper part of the back, that can result in difficulty holding your head up, a condition known as a chin-on-chest deformity. And this is something that can affect people's ability to look forward and to see the world. It can secondarily then result in an increased risk of falls. It can even, in very, very severe cases, affect someone's ability to swallow and to maintain nutrition. And so it really can be a very, very disabling condition that is often linked to very poor bone health.